2 initiates have died in the Eastern Cape and more than 20 have been rushed to hospital after an initiation school they were in caught fire in the early hours of today. The incident took place at Qumbu near Mthatha. 2 traditional nurses who were with the initiates have also been hospitalized along with the stricken initiates. To discuss this further, we are joined by Sizwe Kupelo, who is the Eastern Cape Health Department spokesperson. A very good afternoon to you, Mr. Kupelo. Thank you so much for joining us. Now, a tragic story. What is the condition of those in hospital?
10 of them were to be treated and discharged, and 13 were to be referred to Nelson Mandela Academic Hospital as they sustained burn wounds. So they have to be treated for that. 2 traditional surgeons, traditional nurses, have been admitted at the Nelson Hospital outside Qumbu.
Now, do we know what exactly sparked the fire?
Well, I wouldn't want to speculate. I would want to allow the police to conduct their investigation as to what may have caused the fire. But you will understand that this was a temporal structure which had just been erected to house those initiates for the duration of their stay in the bush. And it was built of a grass.
And having said that, Mr. Kupelo, what safety tips do you have for initiation schools and to initiates and parents?
As the Health Department, we've been working with traditional leaders and other government departments to ensure safe circumcision season. And we've set aside 13 million rands for that purpose. We hired additional 4x4s, additional staff in hospitals, and also those who would be visiting the initiation schools to ensure that we minimize the risk. There are 2 ways here, 2 elements. There's the risk of post-circumcision and risk of medical ailments, as well as tragic incidents such as this one. So we would like to urge all those involved in the custom, one, to ensure that they respect and adhere to the law or the act that regulates the custom in the province. Secondly, take extra precautions, especially when building those temporal structures or amaboma or initiation schools. Make sure that they are built in a safe manner, built properly so that you minimize the risk of the structures catching up with fire. And also ensure that boys, would-be initiates, before going to the bush, they undergo pre-medical checkups to ensure that those who may be suffering from chronic conditions such as TB, diabetes, and other conditions are detected before, and make sure that those who are not fit to be in the bush, especially under these freezing conditions, are not allowed to go to the bush. Thirdly, post-circumcision remains a concern. Apart from the 2 who died this morning from this tragic incident, we had already recorded 2 who died from medical conditions subject to confirmation through autopsy. But we understand that the boy who died from Ngeleni presented with hallucinations and confusion, which is a symptom of a dehydrated person. So the purpose of our medically trained officers going around is to ensure that we prevent those minor occurrences and ensure that we treat them either in the bush or take them to hospital when necessary. So those involved, they just need to work with us to minimize all those who die, Simpiwe, are dying unnecessarily. They are not supposed to die from circumcision. This is supposed to be a passage that is coordinated appropriately to ensure that when they come back, there's celebration all over. We don't have to mourn, we don't have to count bodies if we do this correctly.
And just a quick one there, Mr. Kupelo. There's the issue of the bogus traditional surgeons and a lack of a pre-medical screening. So how far are we in terms of clamping down on illegal initiation schools, and what has the government done in that regard?
We are dealing with that decisively already in the areas of Libode and Mweleni. We have arrested 11 bogus traditional surgeons and nurses. This afternoon, were teams that will be operating in the area of East London, where we received complaints from concerned parents. And when we went to assess, we discovered as many as 30 underage boys who were circumcised in contravention with the new law. And we also discovered that there has been mischievous elements that have been operating there, because some of the boys were discovered with their wounds being dressed in shoelaces. I mean, that is what contributes to this post circumcision, the boys developing sepsis and gangrenous penis. So we are going to deal decisively with them. This operation that is going to take place this afternoon is led by the police, the traditional leaders, as well as our officials. And I want to assure everyone that we are going to put a stop to this. We are going to ensure that the law is complied with. And we just hope that the justice system will also assist in this regard. Because sometimes arrests are effected, but when cases go to court, sometimes they get struck off the roll when the parents who would have opened cases stop appearing before magistrates. So we hope that this time around the justice system will act in a manner that will also assist in putting a stop to what is happening in the Eastern Cape. It's a worrying. It's been happening from 2006 to date. We're talking of over 500 boys that have died unnecessarily. So something has to be done, and we are doing it. We just hope that all the role players will play their role.
All right, Sizwe, thank you so much for your update. Really appreciate your time. That was Sizwe Kupelo, the spokesperson for the Eastern Cape Health Department, speaking to us live from the Eastern Cape.